Welcome to Oasis Quick Assessment Tool, or OQAT, tutorial. Oasis Quick Assessment Tool, or OQAT, is Health Connect Pro's solution to one of the most common problems of home health agencies and clinicians when completing a comprehensive patient assessment during SOC or ROC. The patient-specific assessment and Oasis data collection requirements must be completed in a timely manner, consistent with the patient's immediate needs, no later than 5 calendar days after the start of care. OQAT simplifies submission of the completed assessment for a more accurate and efficient plan of care, timely submission, faster processing, hence a more streamlined method from patient care to claims processing. You will begin by accessing the Health Connect icon on your tablet. Tap to launch the program and type in your credentials. Once you're logged in, tap Scheduled Visits to view your scheduled SOCs. Select the name of the patient and tap Details to start. A time clock reminder will pop up to remind you to put in your time in and time out before submitting your assessment report. Tap OK to begin your SOC. This is the summary page. Before you begin, remember to put in your time in the green button here. The summary page contains important patient details that include patient name, date of birth, social security, episode and SOC dates, physician information, and patient's diagnosis and symptoms information. The top portion on your screen are the different sections of your assessment report. You may swipe right or left, or tap on the tabs at the top to navigate through your report. At the bottom right of every page, you will find the Home, the List, and the Comment button. Tap on the Home button to bring you to the summary page. Tap on the List button to show you a list of sections that you can tap to navigate through your assessment report. Tap on the Comment button to add more information or dictate your narratives. You can either type your comments or tap on the mic to speak or dictate your narratives, which will be transcribed to text. Back to the summary page, you will notice that the patient information in the gray area are already pre-filled and cannot be changed. You may edit and fill out information in the white fields. Tap on the Edit Locked Info button if you wish to change locked patient information, and tap the Save button to go back. Note that editing locked information may depend on the role assigned by the system administrator. In the Medical Information section, type in or dictate the primary diagnosis in the appropriate field. Provide any secondary diagnosis and actual problems and symptoms identified, any potential problem that you anticipate, and any known allergies. Swipe to save and proceed to the next section. Comments Addendum allows you to add more comments. Type or dictate any information you wish to add to your narratives. The Contact section contains information on the patient's representative and emergency contact, and other details like DPOA, surrogate decision maker, and primary caregiver. Tap on the Comments button to add more information to this section. Any information you add here will be added to your narratives. Tap the Update button to save and return to the previous page. The next section includes information about your patient, such as immunization, advanced directives, your patient's living arrangements, and DME used. Information that is not available may be added in the Comments section to be included in your narratives. For example, patient cannot recall last flu vaccination. This section records your patient's vital signs, risk factors, and fall history. Enter vital signs of your patient at the time of your visit. Enter risk factors such as smoking, drug use, alcohol use, any weight loss or gain, ER visits, or hospitalization in the last 12 months, and any fall incidents and any type of injury. Tap on Comments button to add your narratives and update to go back to your previous page. The Pain and Neurosensory section will describe the pain type and scale your patient may be experiencing. Describe the neuroorientation of your patient. Is the patient confused, disoriented, alert, or agitated? Check the appropriate assessment. Describe your patient's senses. Is it within normal range? Does the patient wear glasses or use hearing aids? Tap on Comments button to add your narratives and update to go back to your previous page. The Respiratory and Cardiac section allows you to record your respiratory assessment, including lung sounds, shortness of breath, or cough indication. Cardiac section allows you to assess heart condition and symptoms. Tap on Comments button to add your narratives and update to go back to your previous page. Complete the genito and gastro section assessment by putting check marks and appropriate dates when applicable to your patient. Any genito or gastro comments may be added in the comment section to be included in your narratives. Tap Update to save. The Endocrine and Skin section allows you to assess and record blood sugar and insulin intake and indicate test results. Skin assessment will let you describe the type of wound, if any, including wound count, location of the wound, size, and wound care provided. You can put the medicine applied to the wound in the wound care field. You can also upload a photo of the wound by clicking on the magnifying glass icon. Select the document type. For example, wound number 1. Select patient name. Type in any comments you want to add. Tap on Camera to launch your camera and take the photo. Tap on Add Pics button to add the photo and click Save button to upload photo. The next section is MS Mobility Assessment and DME used. Check appropriate boxes when applicable. Tap on Comments button to add your narratives and update to go back to your previous page. Swipe to save and proceed to the next section. The Endorsements section lets you specify specific endorsements required for the patient. The Functional Abilities section lets you rate the prior level of functioning of the patient prior to the hospitalization or the illness. Tap on Comments button to add your narratives and update to go back to your previous page. Put a check mark on the boxes to complete the mobility assessment of your patient. Add any comments in the comment section by tapping the Comments button. Complete mobility goals by putting appropriate check marks. Rate your patient's current ADLs to complete ADLs assessment section. Tap on Comments button to add your narratives and update to go back to your previous page. Indicate the ADLs goal of your patient in this section. Swipe to save and proceed to the next section. Complete the recommended discipline for your patient. Check the discipline and type in the frequency and reason for each discipline. This includes skilled nursing eval, home health aid eval, physical therapy, occupational therapy, speech therapy, and MSW. The narrative section allows you to generate your narrative based on your answers from the different sections of your assessment. Before tapping on the Generate Narrative button, make sure you have filled in all required fields and you have added all your comments in the comment sections of each tab. If in case you wish to add more comments to a previous field, just tap on the List button to get a list of the sections, or tap on the tabs at the top of the page to jump to a specific section. Tap on the Generate Narrative to populate your narrative. Tap on the Home button to go back to your summary page. Tap the Save button to save your assessment and come back to it at a later time. Remember to put in your timeout in the orange button here. Update the visit status to Admitted. Tap Submit button to submit your assessment for coding, encoding, and QA. You will now see your patient's SOC status as submitted. This completes your SOC visit for your patient. Thank you for using Health Connect Pro, Oasis Quick Assessment Tool.